Hello, I'm Dr. Leonardo. Thank you for joining me. Today I want to talk to you about PDO Thread Lifting. PDO stands for polydioxanone. It's a material found in cardiac surgical sutures. It's been used in heart valve replacements and other cardiac applications, so it's withstood the scrutiny of the FDA and Health Canada. In terms of its aesthetic application, there are a few uses that I'd like to discuss. First of all, its use as filler. We can introduce the surgical suture into a very specific layer of the skin using very fine needles. We remove the needle and leave behind the surgical suture, which will dissolve over the course of the next 2 to 3 months. And as it dissolves, it will stimulate the skin to produce more collagen. So this can thicken the skin, and it's perfect for crepey skin, to allow it to thicken and create a more youthful appearance. PDO threads can also be used in combination with PRP for hair regrowth. We introduce the smooth PDO threads into the scalp, thereby keeping the follicles in its growth phase, anagen, much longer. Another variation is the use of screw threads. It's basically smooth PDO threads that are coiled. We can use this for volumizing, particularly mild to moderate deficits within the face, like the perioral region. It can also be used to enhance the vermilion border, really defining the border of the lip and making that Cupid's bow pop. The final application I'd like to discuss is its use with a non-surgical lift. For that, we use barbed PDO threads. As the name suggests, the threads resemble barbed wire, and this allows the threads to really adhere to the tissue planes. It is introduced to a very specific layer of the skin using needles and cannulas. The metal component is removed, leaving behind the barbed suture. There's also added length that is outside of the skin, which allows us to pull traction on the whole unit, thereby creating a lift. That exterior portion is trimmed, so nothing is exposed on the outside. Just like the smooth threads, the PDO threads will dissolve over the course of the next few months. And as it dissolves, again, it is creating collagen to maintain that lifting action. This is perfect for the mid-face, the jowls, the neck. We can also do a non-surgical breast lift. It's great for the arms, knees, other areas of the body. A common question is whether or not the procedure is painful, and it really should not be. We apply topical numbing cream to the area and we allow that to sit for about 20 to 30 minutes. We introduce the smooth PDO threads using needles. Just as long as we're in the correct plane, it should be painless. In terms of the barbed PDO threads, we have to inject local anesthesia to the site of entry. We introduce the needle or the cannula, and again, just as long as we are in the proper plane of the skin, it should be painless. For more information, please contact me via email, leonardomedicine@gmail.com. Once again, that is leonardomedicine@gmail.com. You can also call 647-526-5596. Again, that is 647-526-5596. Thank you for joining me.